Your Royal Highnesses, Your Excellencies, dear colleagues, ladies and gentlemen. Unfortunately, I cannot be with you in person this morning. It still gives me great pleasure to welcome all of you to this very important event. And may I start by congratulating our nurses who worked very hard to achieve the result and graduate as palliative care nurses. This work started several years ago in Oman, and it is an effort of many parties. But may I mention one person by name, Al-Mukarram Yuther. Everybody knows her hard work, determination, and effort to improve the quality of life of patients who are having severe illnesses, in particular cancer, not only in palliative care in Oman, but in cancer awareness as well. The private sector has very important input, and I thank PDO for their support for this project. Your aim is to be the ambassadors and the champions to palliative care in Oman. Patients with whether life-threatening or serious illnesses, they and their family deserve and require better care. We need to work together to make their quality of life much better. Unfortunately, the misconception that palliative care related to cancer only still exists even among some of the healthcare providers. The other misconception that palliative care should be provided in hospitals only. In Oman, we have a well-established primary health care, and palliative care can be provided in the community, in the primary healthcare setting, in the regional and local hospitals, or in the specialized center. Our patients with severe illnesses and their families deserve and require better palliative care. They need emotional, spiritual, social, and physical support, and you are well equipped to provide this service. 360 nurses definitely not enough to cover the whole country, and we all aim for more. We should not fragment our effort in Oman for palliative care. We are a small country as population. We're only about 4.5 million, and I think should be private sector, government, and NGOs working together. I wish you all very pleasant and successful day, and thank you very much.
Greetings from the Oman Cancer Association and the Petroleum Development of Oman, known as PDO. We thank you for being here with us today to celebrate the graduation ceremony of our nurses and doctors in the field of palliative care. Palliative care is an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illnesses through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems such as physical, psychosocial, and spiritual. The successful palliative care program organized by the Oman Cancer Association that started in 2013 to 2017, the brainchild of Yuther Rawahi, trained locally but with international certification 360 nurses and 20 primary care health physicians. This program would not have been possible without the funding and unwavering support of the Petroleum Development of Oman to Oman Cancer Association. 50 of these graduates were qualified as internationally certified trainers. The responsible faculty was from globally recognized institutions such as Middle East Cancer Consortium, Oncology Nursing Services, and American Society for Clinical Oncology, ASCO. Around 40 nurses from low and middle income countries were invited into the training program as part of the philosophy of the Oman Cancer Association global and regional collaboration in supporting cancer patients, survivors, and their families.
I'm Karunisa Damani. I'm from Tanzania.
Mushtaq Najmuddin. I am from Iraq.
Kawthar Al-Jabri. I am a nurse in Royal Hospital.
Nidal Al-Jibrini. I'm from Palestine. I'm a medical oncologist. I work in the Ministry of Health.
Taywiz Mushani. I'm from the Aga Khan University School of Midwifery and Nursing in Nairobi, Kenya.
I'm Ahmed, بشتغل في جامعة القدس في فلسطين.
Samir al-Nasri, lecturer at Oman Specialized Nursing Institute.
Mariam Rasuli and work as associate professor at School of Nursing and Midwifery, Shahid Beheshti University of Medical Sciences in Tehran, Iran.
Mutaira al-Busaidi, I'm a community health nurse and I'm working as a national coordinator for elderly and community health nursing in the Ministry of Health.
Being a faculty member, I observed that the component on palliative care was missing.
فلسطين احنا ما عندنا palliative care بمعنى palliative care في محاولات من عدة مؤسسات.
In Kenya, we have limited capacity for teaching palliative care.
Palliative care course is a course that is taught to national and international nurses by Oman Cancer Association in association or in collaboration with international nurses from America and different other countries.
It's touching the patient needs, and it's facilitate people, especially the healthcare workers, to deal with the patient in a holistic manner.
This training course in palliative care, which is done by OCA, Oman Cancer Association, gave me a very strong opportunity to develop my nursing skills, especially in palliative care.
It's built up our capacity as Omani staff nurses to be as a facilitators who can run such programs for our nurses, even in the all settings, not only in community health nursing.
The OCA give me the good opportunity to learn more things about the palliative care.
These courses gave me a great opportunity to become familiar with other countries' experiences regarding palliative care systems, especially in this region.
We really developed a lot by sharing experiences in international people who are coming to train us in different countries.
I think that the course has a great input in our practice because of the collaborative work that we do and sharing the experience that we do.
I did a lot of researches, studies and pilot studies to develop the nursing skills in assessing patients and taking care of cancer patients.
We are planning to introduce and initiate such services for our patients who are suffering from end-life diseases, and really they need to be surrounded by their families in the home. So this training helped me and guide me how we can plan such programs and such services for our community.
We wish that this course continues forever and all the nurses to be aware about the practice of palliative care in practice, education, as well as in research.
I'm Janine Brandt. I'm an oncology clinical nurse specialist and nursing scientist at Billings Clinic in Montana and a pain and symptom management expert. It has been a true privilege to be a part of the OCA palliative care courses. We have 4 unique courses. One is Foundations in Palliative Care, the second is Advanced Concepts, and then we also include a Leadership and a Research course. I think what sets this apart from a lot of different courses is that it's not just about knowledge and learn knowledge in a classroom, but people come with their own unique experiences. They get to share with colleagues, they get to network, and it's really about change and really taking what they've learned out into the communities, not only into Oman, but also internationally as well. And so we're about building capacity and we're about engaging participants and also building leadership capacity throughout the region so that nurses can lead palliative care projects in their own organizations throughout communities and develop new models of care that will truly benefit patients, families, all the people of Oman, and all of the people in the Middle East. The other exciting thing about this initiative is that Oman and OCA has really taken a leadership position and has given a helping hand to other nations who have less opportunities like this. And so we all come together and we share and we learn from one another and we all make the world a better place.
Hello, I'm Susie Newton from the US, and I've been privileged to be part of the Palliative Care Project implementation in Oman. Over the last 6 years, we've done a lot of work. My colleagues from the US, our faculty from different countries within the Middle East, and certainly our faculty within Oman. We've been privileged and blessed to work with so many nurses and have trained approximately 300 nurses who are implementing palliative care throughout the country. We're so appreciative of the work of OCA and of the funding agencies from Oman who have allowed us to do this important work.